So, Bobby, how lovely to be in conversation with you.
And what a pleasure to be here with you, Elizabeth.
I'm going to go straight into my question around why does integrative medicine matter to you?
Yeah, and I've thought about that, and it matters because of how much I'm integrating in not
Mhm.
just the work I do, but the life that I live. And I suppose integration for me is not a method in any way, but it's more a recognition of wholeness and wisdom. And as someone who walks the paths of pharmacy, Ayurveda, yoga, meditation, functional medicine, integrative oncology, I've seen again and again that the human being cannot be parceled out. Every modality I've studied points in its own language to the same truth, that healing moves in two directions simultaneously. There is the horizontal healing that I often talk of, and that's the gathering of all the tools, the practitioners, the traditions that all support the body's chemistry, its systems, its functional balance. But then there's a vertical healing, this kind of deep rootedness of a person in their own center, their own purpose, their own spirit. And I feel that, in modern medicine, we've become so brilliantly skilled at the horizontal, targeting, intervening, correcting. And we've kind of largely lost the vertical, that ancient understanding that's alive in things like Ayurveda and other traditions, but also in, I suppose, modern functional medicine where there's a root cause. There could also be a root cause below the root cause, a core self from which all healing must ultimately grow. So for me, you cannot solve the problems inside of you with only those things outside of you. So this combination of what I call horizontal healing and vertical healing, to me, is why integration matters.
Beautiful, and I'm seeing kind of that confluence point in the middle, and also I was taught about integrative medicine when I became ill about 15 years ago, where I needed everything. It's exactly what you were saying, but also that I every day I use a range of approaches to live well. So I love that because I think that it matters to us personally, and then we get excited and want to share it with our patients. Is that true?
Absolutely. Absolutely. And I think quite often, when we come to an integrative approach, it stems from something from a personal journey quite often, like you said for yourself, and the same for me, probably about 16, 11 years ago. In the same way, there wasn't going to be one path. There had to be multiple paths. And it was through those multiple paths kind of realized that you can keep inputting, but unless you grow from the root, all the
Mm,
inputs almost amount to nothing. And I
mm.
suppose, coming from, a background in pharmacy, in chemistry, I also realize how much all of it is rooted in that chemistry as well. Every
Yeah,
single thing we do impacts the chemistry, but that's
yeah.
including the way we think and feel. And it's this amazing, beautiful garden of chemistry, which I call pharmacy, which I think is so fascinating and somewhat underrated in modern medicine.
I was mentioning you yesterday on one of our new well-being days that we're running from NCIM for businesses, but I was talking about that lovely quote you gave us of changing one thing through ritual, through kind of habit forming changes. But at the same time, I was also celebrating the orchestration of the body with all its neurotransmitters, all its hormones, all its chemicals. The body's kind of regulating 10,000 elements a day.
Mm.
And then that knowledge and skill to bring a well-chosen pharmaceutical agent into that picture. What I think I aspire to is that when we bring it in, we honor the body at that point, that we need to understand the body to make sure it can receive that signal. I don't know how you feel about that.
Absolutely, absolutely. And I talk about that with all the people that I work with. what you throw on the soil is so important. But what you've done to nurture that soil is the fundamental to what you put on it. So if I just
Mm.
put the same pharmaceutical on, 20 different soils, it might only be conducive to one of those. And this is the inner terrain. This is all that chemistry that we're talking about that you just eloquently put together as well. All that chemistry. If that soil isn't ready for it, if it's not, fertile for the seed we're bringing to it, if it hasn't been turned and given all the organics that it needs, then that little seed is not going to grow into a beautiful flower of healing, but instead it's going to become a weed and root deeper. I think this is
Um,
why there is so much disparity in how medicines work for people. There is never one medicine that works for everybody. Never. And it's just impossible because of our uniqueness. And a lot of that can be turned a little by first nurturing that soil. And we can kind of make ourselves receptive a little more to the pharmacology, but firstly by understanding our own chemistry.
Yes, and we're both active in the field of integrative oncology, and that exemplifies that point so well that through rehabilitation, through building resilience, there's evidence now emerging that those conventional cancer treatments are working better because the body can receive it and reduce side effects by kind of being ready for it. Do you know what I mean?
Absolutely. It's ready for it, but it also knows how to move with it or move through
Mm.
it too. Because when we introduce something, it's going to go through multiple different reactions and it's going to go to multiple different places for it to be detoxified, eliminated. I mean, it gets so complex, really. And if we've not got the soil right, then all of those areas get stagnated too, in a sense, as well. And so it's really important that we kind of think about how we maintain this openness in all our channels. Then that kind of brings us back to like more ancient wisdom, like Ayurveda, where we talk about channels. They're really minute, subtle channels. And it's so important as we start to understand their flow is so key. And whether it's still chemistry or a energy, a flow, it's all about flow at the end of the day, I think.
Yes, and we'll come back to that because we've just had our multidisciplinary cancer meeting, and we were talking about helping someone detox from a new trial drug that had
Mm.
made her quite unwell, I think others as well, and they had to stop it. Then trying to work out how the body shifts um, the reaction. But I just want to stop to ask you to define Ayurveda because there will be people listening and watching who don't know what that is.
I suppose Ayurveda, in its probably most well-known translation, Ayur is life and Veda is knowledge. It's the
Mm.
science and knowledge of life. And that life that it talks about is within us and outside of us. It is intra-connected and interconnected. So the beauty in ancient wisdom like Ayurveda is it connects all the dots and it goes beyond just the dots to the energies that flow as well. And when you really start to bring that all together, you get a very different view of yourself or of someone else, but also of your position right here in this moment, how that's
Mm.
arisen, what what has moved through your journey in life to bring you here. In Ayurveda, you have this kind of genetic blueprint that we call the Prakriti, that you're born with. It's there. But from the moment you're born, from the moment that you enter this world, it's disrupted by all the elements around you. So that the perfection, which would be that Prakriti, is immediately turned into something we call Vikruti. It gets, because of all the
Mm.
things that come through from the environment. And it's always the understanding of how do we bring that back into balance. So you can look at it in the sense that if that's your genetics, it's just a backbone. Yeah. It doesn't mean anything really, because it depends what's above it. It depends what's going to switch it on or off and play with the dimmer switches. And that's how Ayurveda looks at life, all the dimmer switches from your environment to from within you and how you synchronize them all. Again, it's all about an orchestration, like you mentioned earlier. So Ayurveda, this wonderful wisdom of life within you and outside of you, it's a wonderful way to look at medicine. And through its thousands of years, its text will cover, surgery as well as herbals, as well as pharmacology. It has everything available. And I think as we're moving forward with our understanding of what happens to us biologically and genetically, that we're starting to realize how much of these things can correlate too. And Ayurveda is a sister science for yoga.
Mm.
And yoga is not movement, it's way more than movement. And so those two things go hand in hand. If Ayurveda was the somatic, then yoga is the psychic. You're bringing mind, body, spirit together. And that's why those two go hand in hand. Don't think you can practice one without the other if you really
Mm.
want whole integration. And that's why those two sciences exist, really.
Yeah. Beautiful. And when we're teaching on our master's level 7 program in integrative healthcare, Ayurveda is a very beautiful whole system approach along with traditional Chinese medicine. But I also see a resonance in homeopathic medicine around what we would call the constitution. In other words, what you're born into in terms of your body type, your reaction to things. I can't remember the word you said. It was something like Kriti or something, but I just wonder, it sounds very similar to what we would call a constitution.
You're absolutely right. And in Ayurveda, we have a constitution as well, you know,
Mm,
often termed dosha. And dosha
mm,
actually means an error,
mm.
because it's things that have gone out of line. What we're detecting are
Okay.
things that have gone out of balance. So once you've sort of figured out that constitution, which is what you are at your most balanced, you can then figure out where you need to work in that integrative model almost of which bits you need to push, which dimmer switches you need to turn, yeah, to
Yeah.
bring you back to balance.
And this is what I think both you and I would love, is to see a healthcare system where the earliest signs of coming out of balance, there would be
Yeah.
support and treatments to bring you back in balance rather than wait until you get seriously ill.
Oh
And
yeah.
I've realized a bit like your, thing that you did at the
Yes.
beginning, like one of the principles for me is balance and alignment,
Yeah.
and kind of aligning with your body, but also with your spirit, like your journey, how to align with what's important to you. And I think one of the things I love about your teaching more than, well, I love all of it, but you do bring a lot of wisdom in, don't you, to those questions about meaning and purpose.
Wow. Thank you. And I do think that that's so important because in the whole scheme of it, if we're going to integrate, there is something deep within that often is very veiled to us just because of the way we live, the
Mm,
environment we're growing up in. We're not taught to look deep in there. We're not taught to sit in stillness with it. And I think, if we could bring that into our fold, I feel like that would be such a great way of having a preventative system because we would understand ourselves intuitively better as well.
mm,
I often find working with people, there is something I always feel is a clinical intuition. There is a heart to heart connection with people. And again, probably the same with homeopathy. You know who you should work with and who you perhaps should maybe not be working with as well. And this is very
mm.
important because there's got to be this resonance. You know that there's got to be a connection to be able to help and to bring all of that back together as a whole. And I think that's part of
We're
this.
kind of Yeah, we're back to chemistry again. That's why I like to work in a multidisciplinary team. And I encourage my team members to, to not be afraid to say, I'm not winning here. Could this person see someone else? Because I really believe that. And I think that we can't serve every individual, but within a big team, there'll be someone who can connect. And it might be through a different therapy. It might be, that the actual therapy isn't right for the person and they need a different approach.
Yeah. No, absolutely. Absolutely. I think that is having an MDT like that is the key to healthcare again, because it can't
Mm,
in silo and it can't be done for only specific systems of the body, which is how it does exist sadly at the moment. But
mm.
what you have there is exactly how the future should be of medicine. I have the great fortune of working for a functional medicine practice, for the Dr. Indra practice. And again, it's through that MDT that you realize the importance of all the levers that you've got together as a team for every single person that you see. And that is so, so powerful. And you realize as well that, there's always someone, as a kind of almost like a central core holding that person. And then you've got all these other people inputting in, which is
Yes.
very key. Just makes me think again, I think in images of a big, big roundabout. And that roundabout is you. And you could have one path coming to that roundabout if you don't see anything beyond standard of care treatments, for example. Or you could have multiple, and that could go into 20 or 30 paths. But what's going on that roundabout is so important because I think when you're on a health journey and you get sort of ungrounded, let's say, by a diagnosis, how do you navigate all those inputs from 20 paths coming into your roundabout?
Mm.
And that central team that kind of almost looks after you is one that allows you to grow a garden on that roundabout. And I think often when someone's navigating on their own, they're doing the best they can, but it ends up being more of a concrete roundabout. There's function, but no growth as such, or things aren't
Mm.
changing much. And again, it comes back to this notion of all these roads are like the horizontal healing again. But if you don't have someone able to help coordinate and synchronize that orchestration again, you don't get the vertical growth of that central core tree from your root upward.
Yeah. And you'll see people ungrounded by the shock of a diagnosis, by the fear of a prognosis, and then eventually a team, a collective can help people ground. And then of course eventually the person starts to know what to do. So it's not only that we as therapists can be intuitive, but our patient clients start to really get that sense of no, yes, maybe, but I'll hold on it because there is so many choices, aren't there, if we're looking at the cancer diagnosis. And I often say to people when they're really overwhelmed, I say, when you see the practitioner, do you leave feeling calm or do you leave feeling afraid? And if you leave feeling afraid, then just think through that because that's the ungrounding. It's like just landing is so important, isn't it?
So important, so important. And I do feel as a practitioner, it's it's part of the role is to open up that inner intuition of the client. And I
Mm,
really do feel that's an important part of it. So that it takes a
mm,
lot of nurturing and it takes a lot of input as well. And
mm,
uh, and to me, that is the most remarkable and probably the most rewarding part of this work is when that discernment comes in and the heart in front of you makes the choices and decisions almost with an unknown confidence because you've been able
mm.
to kind of unveil that lovely light within them. I often
Yeah.
ask people first time I see them, it's like, What lights you up in life?"
Mm, lovely.
I really want to know what is their light.
Mm,
I always know where my North Star is with them if I know what lights them up or how I
mm.
them back when things go off kilter a little bit, how to bring them
Mm.
back to their own light. And everyone has something that lights them up. And I think it's a really beautiful way to kind of navigate through life.
I love that because I often say, you can't jump on a bus without a destination. So, in the same way, if you know what health looks like to that person or what love or light looks like, then you know where you're traveling with somebody, but also, when they say, I found that I could sing today in my choir and I've got my high notes back, and you know that that was what lit them up, then you
Yeah,
think, yes, you're getting your vitality, your energy, your confidence to live again. Yeah.
definitely, definitely.
And I do feel like it's, again, interesting that, Hahnemann in 1960, so, an isolated doctor working in southern Germany, managed to devise a system where you question what does the person love, and also how is that expressed spontaneously, because that is where you're feeling the dynamic energy of an individual, not where you have to extract, but where they can communicate those
Mm.
things more authentically.
Yeah, that's wonderful. Yeah, absolutely. Absolutely. It just kind of makes you realize that whenever anything occurs in life, knowing what are the things that bring the love and the light to you is so important. But it's also is it's resisting the first questions that come as well. And that's often, what do I do about this?
Mm,
Instead is to sit for a deeper moment with just why is this happening and to whom is this
mm,
happening? And I think it's the to whom it's happening can often be kind of the veil to the light of love within, because we
mm.
forgot to who it's happening.
Just to bring that out a bit more, I'm really interested by it. Just kind of, I want to understand that better.
Sure. There's, I suppose, in Ayurveda and yoga, we're always trying to kind of unravel. It's like peeling back the layers of an onion.
Mm,
Subtle, thin membranes, but each one of those is capable of just veiling that true truth within you, that central
mm,
core, that I principle, but not the I ego principle, but the I spirit principle. So we're kind of going a bit deeper here than just the chemistry, but it's
mm,
makes you whole. And I think in 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 working towards that, you're constantly asking questions and reflecting on those questions, whether this be through, a practice of movement, whether it be through a practice of art, poetry, or running, or meditation, or just breathing. All of these things start to bring something a bit closer to you about what your true identity is. And again, in Ayurveda, when it comes to identity, it kind of looks at not just you as a spirit identity in a sense, but also you as a cellular identity. And so often it translates certain conditions and diseases as a loss of identity.
mm,
We know as well that cells do lose their identity and they can go off on their own accord. This is where we have cancers arising, for example. And it's how does one bring those back into their own identity? Yeah. And so it gets quite philosophical, but then I feel as we've begun to more and more understand what I call the dimmer switches, the epigenetics, that there is this possibility to return to some balance of identity. And
mm.
I think we're developing more and more targeted and honed in drugs also that are kind of trying to target some of these areas. and I could probably say more about that too. Um, and I think it just becomes a journey, identity. I feel like I'm not eloquently putting it eloquently enough. And I suppose it comes really from my understanding of the yogic philosophies. And as you're passing through life, it's that constant unveiling because you're working towards knowing your core better. And as you do, you start to discover your purpose as well. And that purpose is your identity within yourself, but also with your connections around you. So it kind of you start to stem from within, from looking inwardly to suddenly being outward as well. But that's where I suppose we understand community is so important for people. We understand all those connections are so important. And then it kind of comes all the way back around to what I said in the beginning. You're an intra-connected being and an interconnected being. And so
Mm.
that's where it comes back to. It's that understanding of that and all the
Yeah,
things.
I think you put it very beautifully, and I know that sometimes, again, when people are really recovering deeply and growing through their illness, they'll say, "I feel much more like myself," but it's not that they're just returning back. It's like they are reconnecting to who they are at a deeper level, because I feel that those veils mean we lose touch. Right from the moment we come out of the womb, there's stress, there's emotional burden. We're just absorbing, we're sponges in those first years of life for a lot of difficulty. So, how we get back to that joyful center that you described, kind of light of joy. And then I have noticed that what follows with that sense of self, true self returning and joy is, yes, people then want to serve. They kind of want to just give back to the world, don't they? And serve
Mm.
it.
Yeah, I think when that arises in you, you can't help but want to return it out there.
Yeah. And you said I might talk more about, I think you were starting to talk about genes and how, those are expressed.
Coming back almost to pharmaceuticals, I
Yeah.
suppose. That's my original profession in a sense.
Mm.
And I think it's kind of understanding what's happening in the body with that really. So sometimes I liken it to the flow of a river, going upstream to downstream. The river's moving somewhere. Yeah. And I think there can be areas where the currents change, or the flow gets redirected, or it gets dammed. Somewhere resistance starts to occur. And so often little stones and boulders can kind of form in these channels where this flow is occurring that create stagnation. And quite often, unknowingly, we place some of those things there unknowingly ourselves, just through those
Mm.
experiences and stresses of life. And I think healing and getting the medicine to work for you isn't just about removing them. It's more about where and how can I release them? And that's part of the journey, just that question. So now, keeping that in mind, and if we start to look at pharmaceuticals through this lens, if there's a boulder in your river, and we have a drug that is absolutely being designed to hit that particular boulder with that particular shape precisely, we might just begin to reduce it in size and then restore that flow. And that's medicine being used wisely. It's being used as the right tool for the right moment and for the right duration. I sadly see some very, very strong, boulder moving drugs being used for the wrong duration.
Mm.
They have an effect, the effect wanes, and yet we continue to add it in. And then that boulder, in some cases, doesn't move, and we decide we need something stronger. So we do, in the field of the pharmaceuticals, we have things the equivalent of TNT. We can go and detonate that boulder, but it does not solve the problem. Often it can be multiplied. If you detonate a boulder, you're left with fragments that scatter in every direction. downstream. They might create new eddies upstream too, because nothing in the body moves only in one direction. There's no linearity. Everything ripples. So that's how I understand pharmacy within the body. And I think pharmaceuticals are not an enemy, but they're also not a savior. But they are one tool among many. And when used with precision and care, and with respect to the relationship as a whole, I think they can be really effective. But with relationship to the whole, that's where, in an integrative fashion, we're turning the soil ready for them. Yeah. Or we're allowing our body to already know the fragments are coming because the TNT's coming in, that it knows how to deal with them prior to that happening. So I've probably given somewhat of a metaphor of drugs there that maybe you've not heard before, but it's how I see pharmacy. And, without even naming a drug in particular, I think they have different ways of working. And we have a real responsibility as prescribers to do them in the most precise manner.
Yeah. I agree. And I was speaking to Emma Bezic of Life Coach GX on the podcast, and she was describing genes that allow the production of GABA aminobutyric acid, but then genes that determine how well the receptor will catch the GABA. And, she was describing it in a way that I could see these molecules of GABA just missing the receptor site. You can imagine in the same way, there are lots of things that have to happen or align to make a new cancer treatment get to the right place. And I think we are probably going to be informed about genes and gene expression and how that interacts with response to cancer treatments or generally drugs. But would you say that's right? We're going to see now, I think, moving into a future of more precision medicine in general.
Absolutely. I think pharmacogenomics is a really big field right in front of us. And
Mm.
I'm already getting clients who come to me for integrative oncology with, tests done by a 3x4 or a 24andMe, having their genetics done. And I think there's only been one situation that I saw the person prior to chemotherapy starting, and a couple of the genetic SNPs said, cardiotoxicity with epirubicin. And epirubicin was the first choice for this patient. So the patient never had epirubicin in the end, but how important it suddenly became. Gosh, sometimes it's the way it's been is that we need to try it. And we're aware and we advise people that, yes, there could be some, let's say, cardiac toxicity with this drug or not. And if you do get it, then we'll move to something else. But actually, we could have checked that sensitivity prior to that drug being given. And so I do think the future of precision medicine is right. It's right in front of us right now. The knowledge is there. All the tests are there. The interpretation of those tests is not so straightforward, though. I know that there are some clinics and some, people out there doing really specific tests to check chemosensitivity before they start certain drugs. And I think that's really, really important to do. And to be honest, sometimes when I've seen, the pharmacogenetics come through for someone and the drugs that they are kind of being prescribed, you just realize that, this is going to be one of those moments where this ripple effect is going to cause more and more eddies downstream and more problems. And so, for me, it's my duty of care then to let the prescribing doctor know that this is what I've seen and this is what could potentially occur. And so then you have to make some really, sound clinical decisions. But because there's not, I suppose, consistency in these tests as yet, or there's not, let's say, on the NHS, there's not one test that we would all use, so we know we've got a standard. I think it's quite hard for prescribers to necessarily take on that information as well. So I think it's a bit of a blurry field yet. I don't know whether you've had to deal with much with the pharmacogenetics, but I'm certainly seeing more people coming with those things.
Yes, and I mean that trial that's just been reported on in the NHS around picking up circulating cancer cells. They used the endpoint, which I thought was a very ambitious endpoint about preventing people going on to have advanced cancer. But what they did do is pick up early cancers in some people for whom that was very, very important for them. So again, it's the way that, research is so important in every area. But
Mm.
based on that one study, would you stop the movement for change that allows people to understand whether they've got circulating cancer cells? And again, it's the interpretation and where you place that information and also how you use it in follow up. So it's
Mm.
almost like every element of precision medicine needs high quality research, using it in the clinical field as well, and building up that experience. So we've a long way to go, but I think in the next 10 to 30 years, we will see a transformation of just, let's not use that antihypertensive because your body can't process it like the other one. You know what I mean? And
Yeah.
often patients would say, I don't think that medicine suits me, doc. And
Yeah.
they'd be told, of course it does. But actually, that's the other thing for me is the intuition and the evidence coming alongside each other.
Yeah, no, absolutely. I really do feel that it'll be even sooner than the 10-year mark before we.
Yes.
So,
Yeah.
from what I'm seeing and what I'm sharing with GPs just locally is actually, yeah, this patient's not going to respond to your bisoprolol very well because they've got a problem with their P glycoprotein. So yeah, there's going to be a problem with the efflux of it. And so sharing that information can be a little bit like, because it's not something we're used to yet, but it's already coming out and, navigating that. uh, I mean, I just, there's got to be a lot of education so we can all navigate it well, is probably the first and most important thing. And a lot of education for the public and for the people that are coming for these tests as well as to what the implications are and what it means for you from the, from the probably the side where there's a lot you can do about things if you already have the awareness of them.
Yeah.
And I think that comes back to this notion again of how do we equip people to be able to deal with that awareness? And so then it comes back to the other practices that we have in our integrative toolbox, because harnessing awareness, understanding how we center ourselves allows us to receive information differently and do with it something different too.
Yes, I love the way you're combining really practical data, quite detailed new testing, but with a real whole system, mind, body, spirit approach. Because, of course, by doing that, you increase the range of choices because you might find someone says, well, actually, give me some lifestyle approaches to manage my metabolic health so I don't need bisoprolol. Do you know what I mean? It's like it becomes a series of questions rather than presumptions that will stick you on that, and then you just go off and come back in 10 years.
No, absolutely, absolutely. I mean, I think so often, I think with everyone, I always bring in a little meditation for people, just
Mm.
because we have shown clearly through brilliant research that sort of mindfulness-based meditations will reduce your interleukin-6, will reduce your CRP, will reduce these pro-inflammatory cytokines. And we also
Mm.
know that meditation can also do the other side, can balance the anti-inflammatory cytokines. So for me, one of the really nice tools is a 5 minute a day practice. And I think when we look at all the research and put it together, 5 minutes a day for 30 days is pretty much it. If you can do
Mm.
more than that, even better. But
Yeah.
that is it. I think when we put that into the equation and say that that actually then starts to change your perception of things around you, changes your receptivity and your reactivity to things around you, then you realize that when we start to share this new information, we've already got souls that are going to be able to take it.
Beautiful. Well, look, we have to finish. It's gone whizzed by. Is there any final thing that you wanted to share with our viewers and listeners just as we come to an end?
I think we've sort of said so much, but I think, again, I think it's just really key for us to realize that we cannot solve the problems inside of us with only the things outside of us.
Mm.
So I always call for us to be able to come inward, not outward.
Yeah,
And from that point, sometimes less can be more.
yeah, absolutely. And that place of quieting and reflecting and connecting in. So thank you so much for all your experience and wisdom and putting this into practice in such a exciting way as a pharmacist trained in this much broader model of functional and integrative medicine and Ayurveda. Amazing your journey. So thank you very much for your time, Bobby.
And thank you, Elizabeth. And as you know, you're a great inspiration to me. So thank you for having me here today.
You're very welcome.